All right. Well, hello, Dr. Perry. Welcome to the Unfiltered Healing Podcast. It's such a pleasure to have you on today. How's your
Well, hi,
morning going
Rachel.
so far?
Yeah, thank you so much for having me on. I'm grateful and honored to be here. Thank you for asking.
No problem. You are definitely one of the pioneers in the chiropractic profession. And so, I'm always stoked and honored when I get to talk and chat with other people that do different things within our profession.
Hmm.
Um, Especially being a craniopath and a cranial physician, you kind of feel like you're on an island sometimes because
Oh,
other
yeah.
people don't really do this type of stuff. Uh, so it's awesome that we get to, meet and talk about different types of topics. Now, I know that you are the Lymph Doc. You talk a lot about the lymphatic system and you've done extensive research on that. And so I'd love to just begin and talk our conversation more about, the brain, how the brain detoxes, because that's what I focus a lot. And that's what I found was just missing in my own healing journey as we, get into this profession is I had typical chiropractic, I had things of that nature, but there wasn't as much focus on what the brain needs to detox, what, the nerves need to heal. And I know that you've done extensive research on that and you love talking about that topic. So I would love to jump into that and what really got you, started on that for yourself, looking into that part of what was missing in, our profession or healing chronic things in general.
Yeah, that's a great question, and I'd love to. It sounds like we might have similar stories where basically I had to find a way to rescue myself.
Yeah.
What I mean by that is like a lot of people who get to a point where may they have pain and suffering, and you don't seem to be coming through the other side, or whatever you're trying to look for or use to help
Mhm.
doesn't help. And then you
Mhm.
ask, why is it not working for me? But it may have helped other people. And I got very frustrated because the traditional approaches, even chiropractic, which I've been doing for about 27 years, is a piece of the puzzle, right?
Mhm.
But I just couldn't get well from an illness that I had. And I never really gave it a name, honestly, like so many people who have a blanket statement of an autoimmune disease. It's just something where the body supposedly turns on itself and they're not quite sure why. And then they can't give it a label,
Right.
which in and of itself can sometimes make you sick when you get a label.
Yep.
And I said, you know what? I mean, why? I got to look at things a lot differently. And that's when I got into the lymphatic system, which
Mhm.
subsequently got me into the glymphatic system with the glial cells in the brain, which I'm sure we'll get to.
Yeah.
But, here's the thing, I mean, it's a system of the body that I never looked at in my entire journey of being ill, or honestly in my educational journey in the healthcare field. I mean, they probably covered it for like 15 minutes when I went through
Yeah.
chiropractic school, which was way back in the '90s. Um,
Hasn't changed much.
but then it was just like, yeah, they're skipping over it to get to the good stuff, you might say, like what they
Yeah.
thought was the most important, which is your nervous system. And then I'm
Yeah.
like, you know what? All the systems of your body are important. Otherwise, you wouldn't have them.
Mhm.
So to me, they're all interrelated. And I don't believe there's really one more important than the other in relationship to how they work together as a ecological system.
Mhm.
But it's also, I came to that point because I tried to look at everything else, and it was the last thing that I looked at, and it ended up being the answer to a lot of questions that I've been trying to find since I graduated 20 some odd years ago, of why in the world the body might get better, but it doesn't stay better, or why stuff doesn't work at all.
Right.
And once you look at the lymphatic system, that it's a main player of your cardiovascular system
Mhm.
and your immune system.
Mhm.
That's kind of important in your relationship to heal, because the cardiovascular system is the flow system of the body, right? Not just for training and your heart, but of blood flow, arterial flow, and venous flow.
Mm.
That's nutrients to tissue and waste from tissue. That's what that is. And then your immune system, which is the way that you fight off anything that's trying to take you out. And
Right.
you soon learn that those two systems never function alone, even though we try to treat them alone. We isolate them with specialty.
Yeah.
And one of my lines that I tell people all the time is that no system in the body ever works alone. It
Mhm.
never gets injured alone. It never heals alone.
Mhm.
And there's no such thing as an isolated injury, and there's no such thing as isolated healing. You have to look at it all. And the thing that scared me the most was not necessarily the physical pain. I mean, it sucked, don't get me wrong.
Yeah.
Life was very difficult. But what was more terrifying for me is when I lost brain function. What I mean by that is that um, uh, I had so much inflammation in the brain
Mhm.
that I lost the ability to think, to
Mhm.
articulate,
Mhm.
even feel like I could put sentences together. I was forgetting things that were immediately said to me. And I was in early onset Alzheimer's, I think, and I was showing signs of severe neurodegenerative disorders. And this was about 8 years ago.
Mhm.
And that was more terrifying than the pain. And I tried to look for why that is, why I have so much inflammation in the brain. And when I started to work the lymphatic system, my brain started to get better and
Yeah.
it started to come back. And I'm like, that's quite interesting. Because I started to look at the brain through neuroscience and stuff like that. But even that just goes after brain rehabilitation and brain exercises. And I'm like, that's great. But what about the environment that the cells live in and the brain lives in? And then that's what led me down the road to isolate a little bit more on the lymphatic system for the brain, which up till a short while ago they didn't really think you had one anyway.
Right.
And when you mix those two together, because you can't work them separately, you
Yeah.
can't work the brain lymph separately from the body lymphatics.
Mhm.
Even
Mhm.
though one sits on top, and the head and the neck and the body, which once again we usually try to separate the two, and
Yeah.
that's impossible. So basically, I know I kind of rambled on there a little bit, but the answer to your question was I got into this work from my own pain and suffering and having to rescue myself. And when I started to feel better and begin to try to, I don't like to use the word perfect the stuff that I do, but I always try to do it a little bit better because it's always changing based on new science or people that I see or the results that I have or what works or what doesn't work. And I just found so many other people that were feeling the same way that I was feeling and they were lost. And I
Yeah.
started to do the same things on them and they started to get the same results. And I'm like, okay, this is pretty damn cool, actually. So that led me to where I am right now.
Yeah, and I think it's so true, like, even in the alternative medicine field, we can get very stuck even on a certain system or a certain diagnosis or a certain label. Because I know personally for myself too, with my health journey, when my brain started getting involved as far as foggy and losing memory and stuff with my own health journey, it's so debilitating, and it's complex, but yet simple when you look at the body as an entire system, right? Um, and so, why don't you talk a little bit more about um, kind of how that system works specifically in the brain? Because I know it's systemic; it works with the whole body. But what is it? What is it comprised of in the brain, and how does that system work effectively?
Yeah, and so here's the thing about that is they're constantly discovering more about these
Hmm.
systems in the
Hmm.
brain through the glymphatic system. And this
Yeah.
glymphatic is for glial cells in the brain, which you've got several different types. And I really think that with the way science is going, we're going to discover so much more because now that we can see the brain in real time with functional MRIs, and then there's such an epidemic, honestly, of brain disorders and
Yeah.
neurodegenerative disorders, and they seem to be increasing
Mhm.
the rate of those, not decreasing. Right? So now that they'll start to devote a lot more resources and research and science to it, which is going to be really exciting, because like I said before, previously they didn't really think that the brain had its own lymphatic system pathway. They thought it
Mhm.
was like an immune privileged organ. First of all, I think about that. That's just stupid, right? I mean, sometimes why can't you get a heap of common sense? Because why in the hell do you think the, nature or the universe or God or whatever you believe in wouldn't design a system where the most complex, amazing thing in the universe wouldn't find some kind of way to keep itself as healthy as possible, right?
Yes.
And
Yes.
I have a phrase that I use all the time. It's, you cannot get well in the same environment that you became ill within.
Yes.
And people say, what kind of environment? And my answer is yes. But the external environment that's always coming at you, through a lot of it you can't control because it's just being on this earth with modern technology, you're going to get toxins in your body, no
Mhm.
questions.
Mhm.
And then people say, what kind of toxins? I'm like, yes. I mean, it's just everything that you can think of. But it's also the internal environment that your cells are living in and bathing in, because we're mostly a fluid filled environment, right?
Mhm.
Mostly water and what they call interstitial, big fancy word that medicine likes to use, interstitial fluid, which is basically the fluid in between the cells and the tissue that you're bathing in. And I just tell people, think about like a fish tank. I mean, you're a giant fish tank full of water, and then your cells are the fish. That's the way you can view it. And so that environment has to find a way to keep itself purified, and the lymphatic system is a big part of that. And then you also have the internal environment of your thought processes, like how you think, right? Positive
Yeah.
thoughts, negative thoughts. But here's the thing that's interesting with that. It's hard to control your thoughts and wire them and change them and get neuroplasticity if your brain's living in a toxic environment, which makes these neuroplastic changes much more difficult to occur.
Yeah.
So it's almost
Yeah.
like it's not your own fault that you always end up sabotaging yourself. Or listen, we already know what we need to do 99% of the time. Why the hell can't we do
Mhm.
it?
Mhm. Mhm.
Right? That's
Mhm.
because you need to have the changes in the tissue. You need to have the changes in the brain or the nervous system, and that's neuroplasticity. So I came to the conclusion, well, brain rehabilitation is great, brain drills are great, but the brain can only work with the environment that it's living in relationship to its own blood flow in and its own blood flow out. It
Yeah.
requires an immense amount of energy to function. It takes about 20% of the available oxygen in the body. Your kidneys are a second. Those are the top two. And there's no accident that the kidneys are the main water organ of the body in relationship to dealing with the end part of lymph drainage.
Mhm.
So, in my viewpoint, if you got a toxic brain, you got toxic kidneys. You got both. They go together. And
Yeah.
so that energy system, if you have a toxic environment, then you're already going to struggle for the 20% of energy and oxygen that you're taking for the body, because
Mhm.
it's not in an environment that's conducive to it.
Yeah.
So I firmly believe this. There's no way in the world you're going to be able to get your brain to drain, even if you do cranial work or lymphatic work, if you don't
Mhm.
take care of the 99% of the lymphatic system below the neck,
Yeah.
because they
Yeah.
go together and they work on pressure. Everything works on pressure in the body. So when you learn that the toxins from the brain drain out significantly through the venous system of the body, which you already know, and anybody who does cranial work in here knows it drains out through the internal jugular vein,
Mhm.
which comes out of a hole in your skull called your jugular foramen, where I don't think it's any accident that your vagus nerve comes out of there too, the most important nerve in the body in relationship to controlling the inflammatory reflex and the stress response for the whole body. So
Right.
that being said, if you have toxins around in your brain and your brain stem, you're also going to impact the entire nervous system and your ability to actually heal itself.
Yeah.
But it's supposed to come through that internal jugular vein. Very often, that system is overloaded,
Mhm.
and then it's got to come out through other means, through your cerebrospinal fluid, the CSF, which comes out through several different pathways and along actual cranial nerves,
Mhm.
nerves coming off the brain and the brain stem, that the toxins go down, one of them being your optic nerve. So, a lot of times people who have toxicity in the brain have eye difficulties, vision
Right.
difficulties.
Yeah.
And the eyes are one of the largest things that takes the biggest amount of energy to function. So those are the people that'll read a book for 5 minutes and they're exhausted and have to take a nap for an hour.
Yep.
That's a brain toxicity standpoint.
Mhm.
Um, so and then they drain through the lymphatics and glymphatics, they call them, through the glial cells without going too crazy into it, mostly through your astrocytes, they call those. And then your meningeal lymphatics that live around the periphery of the brain. So they all have to function. But here's the takeaway: they all got to drain somewhere.
Mhm. Mhm.
So where do those things that are in the brain drain to? Well, they're going to drain to the deep cervical lymph nodes in your neck. So lymph nodes are basically mini toilets that are around your body that are supposed to flush out bacteria, parasites, viruses, toxins, cancer cells, metabolic waste, cellular waste, basically anything that you have inside of your body that's not supposed to be there for a long period of time, including excess large proteins, including pro inflammatory cytokines that
Mhm.
cause inflammation.
Yeah.
And they got to drain to the deep cervical lymph nodes. What that means is that they're in your neck and they're deep, particularly along the vertebra and along the deep musculature.
Mhm.
And if those are blocked, then they can't drain efficiently from the brain,
Right.
right? So
Mhm.
you have to clear the neck before you clear the brain. But even the deep cervical lymph nodes will drain into the venous system of the body, the veins of the body, right at the collarbone of the subclavian vein, sub below clavian clavicle vein. It
Mhm.
drains into there and then ultimately back into the heart, and then it goes out again. It just changes name, just known as plasma at that standpoint. But then even the internal jugular vein that's in the head that takes 80% of the toxins, where do you think that drains? Same place.
Mhm.
So everything's got to go to the same outlet no matter what. All right, which is basically right at the bottom of the neck and above the collarbone, and it has to go out to the circulatory system.
Right.
So, um, the head and neck are beholden pressure wise to the rest of the lymphatics in the body.
Mhm.
So, I don't do lymphatic work for me until last.
Yeah.
Like, you get a full body lymph assessment and a deep lymphatic treatment first, because you're going to get better results in my approach by making sure that the drain point is open and it doesn't have backflow pressure pushing up against it,
Mhm.
which we can get into more later. But
Yeah.
here's the thing. Here's my takeaway. I honestly don't care what the hell you find in the head and what it drains through. I don't care if you find 50 drainage systems in the head. What I'm going to ask you every damn time is, where are they draining to? That's what I'm
Yeah.
asking you.
Yeah.
So if
Open
you
the book.
don't clear the ultimate drain point, it doesn't matter what you do up there, right? So that's why you
Mhm.
always work, in my world, bottom of the neck up, bottom of
Mhm.
the neck up. You never work from
Mhm.
top down ever,
Mhm.
because that's just how fluids flow in the body. You never want to work higher up to send stuff to a block that's lower, because it's just like nature. If I'm pushing water down to a point that's going to hit a block, the water is going to backflow right back where you sent it, and it's going to push back harder. It's going to cause even more of an issue. So that's why I like cranial work, because cranial work, just like any work in the body, gets movement and motion
Mhm.
in tissue, in the joints of the head, in the because that allows you to change pressure. in the head, which
Mhm.
allows you to then circulate the fluid so the fluid can move more efficiently. So the cranial work for me is this type of mobility work that I would do anywhere to try to get more motion and movement in tissue, because we know that two things move the lymphatics primarily. One is movement. So
Mhm.
if things move, that's movement. If things doesn't don't move, that's called stasis or stagnation,
Mhm.
right? Nothing thrives in stagnation. Nothing,
Yeah.
right? And the other one is breathing. And breathing is also a form of movement, right?
Mhm.
And you know from cranial work that every time you breathe, you're supposed to have the skull expand and contract.
Yeah.
Your tailbone moves and the spine moves along with it in the middle, and that's the pump driver for the cerebrospinal fluid, which is one of the main drains of the toxins that can come out of the glymphatic, not only in the skull, but along the spinal nerves as well.
Right.
And then that has to work with the other pressure systems of the body, including the cardiovascular system of the body. Because if you get stagnation and stasis in the veins of the body, the venous system of the body, which is where most of your blood flow resides, or in the venous blood. Like 70% of it's just going to park right there.
Mhm.
And then if that gets stagnation, that's going to backflow and you're going to get stagnation in lymphatic flow. And then you're also going to get stagnation in arterial flow on the front end, because now it's going to take more pressure to try to move that through the
Yeah.
heart, because everything thickens up when it doesn't move, right? So it's a full body system. Here's the big takeaway, Rachel, that I tell everybody is that it's not just knowing what to do. That's important.
Mhm.
But what's even more important is knowing what order you're going to do things in.
Mhm.
Because if you do the treatments, all right, then you have the components for the treatments. I will contend until I die that they're gonna work better when you shift the order around, of how you do those techniques.
Yeah.
That makes all the difference on your end results, right? So it's one, having the right tools and techniques,
Yeah. Yeah.
that's important, but it's also the order in which you do those. What I find is that more people are concerned with the first part, having
Yeah.
the right tools, and I'm like, "That's great, but now you gotta explain to me why you're doing it the way you're doing it." And then if I
Yeah.
don't get the result that I want, I know 2 things. 1, my order's probably wrong, first and foremost. Second, my tools might be wrong. My tools might be
Mhm.
wrong. And that
Yeah.
just comes down to the concept, and then the concept is that clearing of the system. So as people always say, what should I do about my lymphatics? Well, the first step is just becoming aware that they matter.
Yeah. Right.
And then that's the road to learning, because you can't change your lymphatics. You, capital YOU. You can't change your lymphatics until you become aware of your lymphatics. They're always changing, but you have no idea what they're doing until I consciously become aware of it. Then I can change it. Right. And then that just comes down to different techniques. But the techniques for me are based on the concept, because I think if you got the wrong concept, your techniques won't work.
Right. Yeah. And I can
Does
speak
that
to
make
that too.
sense?
It makes absolute sense. And I can speak to that too because, how I was trained with cranial and primarily SOT, which is, the technique that
Yeah. Mhm.
started the cranial stuff for chiropractic. They train us in that method of bottom top. And he always left cranial work till the end, working the body, balancing the lymphatic system, the organs, all of that. And then you get up to the head and balance that system. And I also want to mention something as well, in case, listeners missed a while ago when you spoke about, when your brain is toxic, when your lymphatic system is toxic, um, it is literally hard for us or impossible for us to be able to process other things. And I find that when people come into my practice as well, and speaking of that order, where they've done different things, maybe for, PTSD or stress from a brain injury or whatever it is, um, but they have not addressed, you know, the toxicity levels draining the system and getting things actually moving. So one of those neuroconnectors, that vagus nerve and other nerves start regulating, right? And so when I start explaining that to people, it's like this is once this is open and flowing and these drainage pathways are open, now you can actually be more efficient at some of those other modalities. But if you go in the incorrect order, like you said, you're not going to be as efficient. And so, if people miss that, if you're doing other modalities and they're not working, go back to the steps of focusing on these systems that Dr. Perry is talking about, because that is what makes these other systems so successful.
Yeah,
And
that's really important. I'm so glad that you circled back on that, right? Because here's what I find too is that so many people don't get well from good things that can help them because one, they have a system that can't tolerate the good stuff either,
yeah,
which means that you have to have a system that can accept what you're trying to do to it, your nervous system. And the longer you've been sick and the more you've been stressed and the more toxic you are, the less positive interventions you can tolerate because your system
absolutely.
will reach the breaking point faster and it'll hit shutdown mode, which means it will stop letting you try to change anything because
Yeah,
it's going to feel threatened because it's too much and it's going to um, sink in and hold harder to old habits and old behaviors that worked for it in the past. And that's really important for people to understand is that your body never does anything without a reason, even if you don't understand what it is. But I'm going to tell you
mhm,
what the reason is it ever does anything is so it doesn't die right then and
yeah,
there, so it
yeah,
can live to the next second. Whether you feel good or happy is irrelevant. Whether
right.
you're not dead is the most important part. Those other ones are a distant second. And it's
Mhm,
going to keep repeating those past behaviors because they were worthwhile for it at one point, and it's
yeah,
just gonna keep going back to it because it worked in the past, and
exactly.
sometimes it won't let you give new ones because of that toxic environment that you're in. So those are the people that it's a huge part of therapeutic failure is this.
Yeah, yeah,
We forget that therapy interventions are also stressors to a nervous system highly under stress and an immune system highly under stress. So a
mhm,
person may be only able to tolerate one thing on one visit for 10 minutes, and then that's it.
yep,
It just because I keep you there for your 45 minutes and I do 10 more things doesn't mean it's more beneficial for you. Sometimes it's the exact opposite
yeah,
because your nervous system won't let you change anything when it gets to an exhausted standpoint, and then you
yeah,
stop.
yeah,
But that's not how we think. We think more is better, and it's not.
mm-mm,
Better is better. But
yeah,
making that environment conducive towards your interventions is huge because listen, I knew I had cognitive decline and I knew about neuroplasticity, but you have to remember this when neurons wire and fire, they create metabolic waste.
mhm, mhm,
And where the hell do you think that waste has got to go? It's gotta go out. What
yeah,
happens if it already can't get out? And then I'm
yeah,
gonna ask it to fire more and change a habit. Listen, when I ask you to change a habit, you know how much more energy that takes? It takes a lot more energy to change a habit than to keep doing the one you've always done. So that's one reason why your brain does it because it's freaking way easier and it's gonna be make you less tired. So it's not a broken system, it's a highly efficient system that's evolved in nature to keep you alive. So if
mhm,
I drain the toxins from your brain, then you start to get the environment that the cells can wire and fire. And then you
mhm,
say, you know what? I don't know if this is crazy or not, but I'm actually starting to feel a little bit better. I'm starting to feel a little
yeah,
bit more energy. So
yeah,
you do your brain work, you do your brain drills, you do your vision drills
mhm,
after after you do your drainage stuff first. That's what
yep,
I'm trying to tell people. And that
yeah,
that's going to make a difference on whether they work or not,
yeah,
right?
yeah,
I mean, that's exactly what you're talking about.
it's the order, yeah,
It's exactly and it's very see, I'd like to break things down into simple stuff, right? So I believe that chronic disease occurs when you lose the ability to make new cells that work.
yep,
Because if you could make new cells that work, you wouldn't be sick all the time, right?
yeah,
So you're always making new cells, but you're not making very healthy functional ones, right?
Yeah. Yeah.
And you're supposed to you get sick, you get injured, that's life, but you're supposed to not be sick and not be injured. That's called healing and, durability and a nice long, healthy life that you're supposed to
Yeah.
have. So
Yeah.
if chronic disease occurs when you lose the ability to make new cells to work, then you gotta ask yourself the next question: "What the hell do I need to make a new cell that works?" Right. Well, 1, you need energy, right? Because if you don't have energy, nothing is gonna live very long.
Mhm.
Well, the energy process for the cells, it needs nutrients and oxygen.
Mhm.
Those are the big ones. Oxygen in particular, and then nutrients. So it can put you through what they call the Krebs cycle, the mitochondrial powerhouse cycle, ATP, so I can have energy and then do what I need to do and make new cells. So
Yeah.
it needs those, and then it's got to get rid of the waste after it uses those.
Mhm.
Those
Mhm.
2 steps.
Mhm.
So one, you have to think, well, I got to get oxygen and nutrients in, and we try to improve that through what? Through breathing techniques and through changing our nutrition
Mhm.
and our thoughts.
Mhm.
But we have to remember that everything that you put inside of your body nutrient wise becomes toxic when it can't get out.
Mhm. Mhm.
So you can eat the healthiest food in the world. First of all, it doesn't mean you're absorbing it at all.
Nope.
And then two, healthy food gets broken down and becomes ding, 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 waste.
Yeah.
So if waste can't get out, no amount of nutrients on the front end is going to get you where you want to go because that's just basics of physics right
Yeah.
there, right?
Yeah.
Cause and effect. So you try to get the waste systems clean, working at optimum and reduce the amount of toxins coming in, right?
Mhm.
So eating healthy food is better than eating crappy food. So you can check the win box there. But I have a lot of people who do that and they still don't get better. Or they get a bag of 50 different supplements from one doctor as a functional medicine doctor. And I'm like, why are you doing that? They can't even absorb what they're taking now. You're gonna put 50 things in there?
Yeah.
And so
Right.
that's gonna make 50 things of waste is what it's gonna do. And so you
Totally.
just overloaded the system. So
Yeah.
you have to work the back end first. And doing that through lymphatics is huge. And then doing the
Yeah.
brain.
Yeah.
That's the people say it can't be that simple. I'm like, who the hell says not? Why not? Of course it can.
Yes.
You can make anything complicated. It doesn't mean that you're right because it's complicated. But if you take those two fundamental principles of, okay, I see in my world, everybody's concentrating on the front side,
Mhm. Mhm.
nutrients and
Mhm.
breathing, diet and breathing. That's good.
Yeah.
But do the toxin side first, right? If you do the
Absolutely.
toxin side first, you'll notice the nutrient side works way better,
Yeah. And I
right?
think with
And
that
that's what
too
I'm talking about, order.
yeah. Yeah, and I think with that too, there is becoming, more of a realization of that. I think, now what we've known with like the cranial nerves and, specifically the vagus nerve is like all the rave now. And you're seeing, I've seen a lot of functional medicine doctors talk about it, which is awesome. But there's so many facets to the vagus nerve, right? And it's a modulator. And so you do need all of that drainage system. You need all of that system working together. So for individuals maybe just hearing about the lymphatic system or just kind of exploring this field and they've done all of these other things, what are some big reasons other than toxins like we've mentioned and I guess movement that can create a chronicity as far as their lymphatic system, and how would they be able to recognize that?
Yeah, great question. So first of all, it's the awareness part, right? Because I have a lot of people who say lymph what?
Yeah.
They may never even heard of it, or if they have heard of it, it's usually in relationship to two primary conditions. Somebody has lymphedema,
Mhm.
which is the term that means that parts of the body, usually the legs, most often,
Mhm.
because they hold the most pressure because they're the furthest distance away from the drain point in the neck.
Yeah.
They get really, really. edema, puffy, swollen, inflammation. Like, I don't care what in the hell word you call it. It just means there's excess fluid somewhere. So to me, it's semantics on what word you choose.
Mhm.
Um, and you need usually, oh, you have to work the lymphatic system, but they'll usually try to do stuff down in the legs. I'm like, well, first of all, you got it backwards. You need to start from the neck down, because you're not going to have a leg problem of lymph unless you've got an abdomen problem with lymph.
Yeah.
I'll stand by that until I'm dead. You're going to
Mhm.
find a problem in the abdomen when you got a leg problem 100% of the time. You just got to look for it. Um, and the other one is cancer,
Mhm.
when they have cancer, because they know that, well, first of all, your lymphatic system is designed to kill cancer cells. It kills them all day long, all the time, so you don't get cancer. That's part of
Right.
its job.
Yeah.
But sometimes the toxins get too built up, it can't do it anymore, and then cancer takes hold because you have an environment with low oxygen and toxicity, and cancer's like, perfect. It's exactly what I like, right? And then it takes hold. And then at that point, you have to be more diligent because it'll migrate anywhere into the body through the lymphatic system, which first of all tells you the lymphatic system goes everywhere
Yep.
if it can send cancer cells anywhere in the body.
Mhm.
But I want people to be aware of it until they get to those particular points so they can work the lymphatic system. And people always say, how do you know you have a lymphatic system problem? And yes is my answer. I'm tongue in cheek, but I'm also serious
Yeah.
because I know nobody's ever done anything intentionally to try to take care of it on purpose. I
Yeah.
mean, it's moving all the time when you move, and hopefully you're doing the right type of breathing, which means breathing through your diaphragm and not your lungs and your shoulders and your neck.
Yeah.
Um, but it's sometimes not enough because it's so overloaded that
Totally.
they can't do it on their own anymore. You have to go in there and physically remove what I call choke points or
Mhm. Mhm.
barriers,
Mhm.
manually, by hand, right? It's just like water in nature. Like if I have a stream coming down there and it gets an obstruction, well, I could increase the water flow at the top, but it doesn't mean it's going to blast the obstruction out of the way. Sometimes I got to go down there and lift the damn rocks out of the way. And
Yeah.
then when you lift the rocks out of the way, guess what? The water already knows where to go all by itself. So the lymph remembers where it needs to go. You just have to come along and remove the blocks. And then it says, thank you very much. I appreciate that. Somebody's finally catching on that maybe my knee is swollen because I'm stuck in my groin and I'm stuck in my abdomen and I'm stuck in my sternum and I'm stuck in my neck.
Yeah.
But nobody ever looks there because they're not complaining of symptoms there. That's what stop chasing pain means. It doesn't
Yeah.
mean stop treating pain. It means don't chase it. Because pain's
Yeah.
not telling me squat. It's only telling me that I got to change something. I don't know what it is. I'm going to start where it hurts first because you expect me to. So I'm doing it more for your psychological benefit than anything else. And then
Yeah.
I'm going to look, and people say, where do you look next? Yes, everywhere. Like you just take a look at the whole body and the whole lymphatic system. So, when people begin to work the lymphatics intentionally, it can make a significant and profound difference in their life. So you can have all sorts of symptoms from a lymphatic system that has stagnation in there. One of them and most common for me is chronic pain
Yeah.
anywhere
Mhm. Mhm.
in the body. Tiredness, fatigue, lethargy, aches, pains, puffiness, swelling, uh, any damn diagnosis you want to throw at me afterwards.
Mhm.
Like, what about this diagnosis? I'm like, yeah, of course. Why? Because all the systems have to work together. So I always reference the fish tank. So
Mhm.
I say, I want you to envision a fish tank. Anything inside of that fish tank is beholden to how well the water in that tank moves, first of all,
Mhm.
through its filtration system, which is the
Mhm.
lymphatic system.
Mhm.
And then the health of that water in relationship to its pH, which when you have a fish tank or a pool, you have to put the chemicals in and say, is it too acidic or too alkaline? Because if it goes too far one way, then you get stuff growing in your fish tank or your
Mhm.
pool and it
Mhm.
gets green and it gets algae. Well, hello, that's what the inside of your body ends up looking like with toxins of all
Totally.
different types. microtoxins that sit there, stealth infections that sit there. And that's an environment where when they come out when low oxygen is around, and then they
Exactly.
take hold.
Yeah.
And I tell people, like, every disease name you give me is gonna be in the fish tank. But I don't know if cleaning the water is gonna take care of your disease, but I know this much: if you don't clean your tank, you don't stand a chance in hell. There's no way
Yeah.
in the world. And
Yeah.
I tell people, if you ever looked inside of a fish tank at fish that are swimming in a tank that's green and all murky, you ever see their mouth? What are they doing? They're like this. If you're watching on video, they're going,
Yeah.
they're struggling to what?
Breathe.
Breathe.
Mhm.
Well, guess what? That's what your cells are. They're struggling to breathe. They don't have the oxygen that they need to go down a metabolic pathway. So then they're going to go down the fermentation pathway
Mhm.
to get
Mhm.
energy.
Mhm.
And when you ferment, that means you're going to get more toxins and open for yeast and ammonia. And that
Yeah.
stuff's going to make its way straight up into your cranium,
Yeah.
and it's going to affect your brain. So you get ammonia in the brain, you get bacteria and toxins and viruses and all sorts of stuff in the brain that leak through the blood brain barrier, and they take out your hypothalamus because that's usually where you'll find the brain barrier the weakest and where the larger protein molecules leak out right through the hypothalamus, which is the HPA, hypothalamic pituitary adrenal axis, big fancy
Mhm.
word, otherwise known as your stress axis
Yeah.
or your hormone axis.
Yeah.
So, I mean, everything is up for grabs when you break through that. And then most of your lymph resides in three places. Skin is number one.
Mhm.
That's why dry brushing can be helpful, but that's just the superficial lymph.
Right.
And the superficial lymph of the skin always dives to deeper lymph.
Mhm.
So that's why you got to clear the deep lymph at the same time.
Yeah.
So sometimes with the skin, when you have lymph issues, the skin pays the price. With all it gets redness, get acne, you get
Mhm.
psoriasis, eczema. I mean, like whatever. Okay,
Yeah.
and the other one is the gut. The gut is the primary holder of most of the lymphatics in your system because that's where your immune system lives, in your gut.
Mhm.
Right? And if
Yeah.
you have leaky gut syndrome or anything with malabsorption syndrome, irritable bowel syndrome, the microbiome may be off. But you got to remember the microbiome also release toxins that the lymphatic system has to take out because it's too large to go out through the venous system. So
Mhm.
the veins can only take out certain size molecules, can't pass through there. And that's got to
Yeah.
go through the lymphatics. So if the lymphatics are overloaded, then it's just going to sitting in that fish tank, and then
Mhm.
anything in the gut's going to travel up to the brain via through the vagus nerve primarily, or the cytokine signaling from those peripheral tissues into the glial cells in the brain. And the glial cells behave like the peripheral cells of the body. So you
Yeah.
get brain inflammation because you got inflammation everywhere else. That's why you can't separate the two. And the other place is from the neck up.
Mhm.
So you've
Mhm.
got about 600 to 700 lymph nodes in the body, those mini toilets. One third of that number is from the neck up.
Yeah. Yeah.
So just think about that design right there. Like if nature put one third of those things from the neck up, probably have
Should
a role
probably
to play with brain health in
should
some
probably
way,
pay
shape, or
attention.
form, right? But what we know with lymph work, the huge take I want people to realize is you cannot isolate lymph work.
Mhm. Mhm.
Can't. So you can have an inflammation in a lymph node, let's say behind your left knee. The lymph nodes behind your knee get choked off or blocked a lot because people sit a lot and the
Yeah.
knee is held in flexion and you
Yeah.
choke off the flow of that. But it's a system that works together. So I can have a lymph node that is choked off or obstructed behind my left knee that can cause pain any damn place it wants.
Yeah. Yeah.
Like, it can hurt you in your right wrist if it wants to. It can hurt you in your left shoulder if it wants to. And usually what it'll do is it'll settle for the area that's got the most vulnerability to it for you.
Mhm.
Something that you may have hurt in the past that
The
keeps coming
weakest link.
back, or
Mhm.
will hit the vulnerable areas of where pressure is not controlled well, which is the lower back and
Mhm.
the neck. So
Yeah.
they'll pay the price. And that's why everybody gets a full lymphatic assessment when they come to see me. If you walk into me and you have a hangnail, I'm gonna do your entire lymph assessment. And I tell people I'm joking, but I'm not joking.
Mhm.
And
Yeah,
then they're like, "Oh my god." Like, 1, nobody's ever done that before, and then here's the second one. "I can't believe how much of my body actually hurt when you touched it." And
yeah,
that's the takeaway, right?
yeah.
You
I
need to
tell
be
people that
aware,
too.
awareness of how much of your body is dealing with inflammation you don't have an awareness of.
Yeah, I tell people that too, when they come in specifically maybe for nutrition is I say, "Okay, I understand, but we're going back here first." And, there was a lot jam-packed into that section that you just talked about, but I wanna go back for just a minute
Yeah, I kept going there, sorry, man, I get on a roll. I
That's
get on a
okay.
roll, I just don't stop.
That's okay. I'm loving it. Um, but I wanna go back to the part just about oxygen for a second because this is one I
Sure.
find, that's very, very overlooked, and not only just with breathing, because I know that you talk about this in stuff that you post and you teach about too, is, diaphragmatic breathing, but also nasal breathing. And something that
Yeah,
I find in the cranial world is even if they've had, lymphatic work on the rest of the body, which, like we said, is vital to do first, when I look inside their mouth, when I look at, how much restriction is in their head, they're clenching, they're grinding, they're severe like mouth breathers and things of that nature. I have to explain to them, hey, you're not getting actual oxygen of where those systems need to the brain too. And for me, that's been a huge relief of that specific lymphatic system, for people with either brain injuries or maybe they're just born with narrowness in their facial structure. So can you
yeah.
speak to that for a second as far as, what you find or how impactful that is in your screening process as well?
I'd be happy to, as long as you do after I'm done, because I wanna hear your perspective. 'Cause
Sure.
you see it a lot. Because honestly, doc, I mean, very few people know the information that you do and you know. So,
Mhm. Yeah, there's that
yeah,
many
that's
different
really big, and I'm glad you brought that up, right? So, I always ask about prior head trauma for anybody that I see, and
Mhm.
I don't care what they tell me, I know the answer is always yes, even though they don't remember it,
Yep.
because everybody thinks head trauma has to be severe where you got a bleeder or you lost consciousness. That's that can be an extreme part of that, but it can be any impact to the head that might even seem inconsequential to you at the time. Even just a simple whiplash or being
Yep.
hit unexpectedly from any direction, you get the whip like that. And those small things can add up, right?
Mhm.
And that's why I always ask about that and try to get as specific as I can about where the impact was, because then I know that I'm going to have to work around those bones. I'm going to have to work them all, but then I'm
Yeah.
going to think about the area of the brain that had the impact. So that's probably where you're going to find some glial cell transformations. And
Mhm.
then that through a brain questionnaire that I ask them, I can see based on their answers where there's more inflammation in the brain that's settling in for them. If it's in the frontal, parietal, temporal, back in the occipital, and those, and it usually coincides to some of the symptoms that they check off, like
Mhm.
poor memory or emotional, or my writing has changed or my balance has changed, stuff like that. Uh, so I know that's gonna have an impact, but the mouth is a huge one, right? Because
Yep.
one, there's a lot of holistic dentists that I deal with, and then they say a lot of children, especially in today's world, have more narrow palates.
Mhm.
They're not as wide, and some of that's because of how the jaws have changed shape because of our food intake of what we're eating more agriculture as opposed to meat, and how much you actually chew when you chew, because not many people chew a long time. They swallow food that's too big
Yeah.
and they don't swallow,
Yeah.
or they breathe through their mouth, not their nose, and sometimes that's through habit, other times it's through obstruction through
Yep.
through the nasal cavity, or how the hard palate is at the top, but it can
Mhm.
also be because you have a tongue that has weakness to it, or you're tongue tied, something like that. But
Mhm.
they breathe through the mouth, which means that the tongue usually sits in the bottom of the mouth when you're a mouth breather.
Mhm.
And so the tongue gets weaker. And when it gets weaker, it gets hypotonic, almost like a muscle that just doesn't have enough tone to it. And it gets wider.
Yeah.
And that's usually where you'll see ridges along the teeth.
Mhm.
Excuse me, ridges along the outside perimeter of the tongue.
Yeah.
That can indicate a weak tongue, a dropped tongue. In Eastern medicine, it easily indicates liver gallbladder type issues that you need to be aware of, which will tie back into lymphatics because the liver produces up to 40 to 50% of your lymph into the largest lymph node in the body that sits in your abdomen. So you're back to that again.
Yep.
And so that can be an impact, or of course, the TMJ. So I always give people tongue exercises. When I do an assessment on people, I do a full cranial nerve assessment of all 12 cranial nerves in the
Mhm.
brain, 1 through 12. So I can see where they may have issues in a particular part of the brain in the back. And so that gives me a view of where I might need to do some work with my cranial work and how it's affecting the rest of the nervous system.
Yeah.
So there's a lot of information that you can gather from doing a really thorough head, neck, um, palpation, hands-on assessment, observation assessment, uh, neurological assessment. Now, many things are not in my wheelhouse that I can't help, so I'll refer them maybe to a holistic dentist, or I'll refer them to a speech therapist or a tongue therapist. But I usually give almost every person that I see who has brain toxicity um, movement mobility drills and strengthening exercises for the tongue,
Yeah.
because that makes a huge difference on how well they can control the muscles of the jaw and
Mhm.
the throat, which
Mhm.
influences the ability for the lymphatics to drain, and
Yep.
also for them to be able to possibly sleep,
Yep.
to be able to breathe through their nose. It's interesting. I've been a chronic mouth breather for most of my life and really didn't pay much attention to it. And I would always wake up with a really dry mouth. And it also led to me having some periodontal issues because of the lack of saliva and dryness of the gums. And then I started to get gum disease. And then that feeds the bacterial microbiota in the system. And
Exactly.
then each tooth has its own devoted lymphatic channel, and the
Mhm.
toxins can enter your whole system through the lymph in the teeth. And then it travels, and they're finding the bacteria in the mouth ends up in joints around the body. So oral health is
So key.
huge in relationship to brain disorders and neuroinflammatory disorders, and also systemic autoimmune disorders, because the mouth is the beginning of your whole digestive tract,
Yeah.
and we don't really pay attention to it, and we should. I mean, I know I kind of went off the rails on the answer there with a lot of things that you can look at, but yeah, so that's why sometimes simply going into doing a little bit of pressure on the roof of the mouth and teaching people where the tongue should actually reside and try to
Yeah.
strengthen it. And when you have a weak tongue, it feels like it's the wrong place. It's very hard to get there, and it feels unnatural
Mhm.
because it hasn't been there in a long time. But when
Mhm.
you can
Mhm.
get the position of your tongue right, and it'll change the way the TMJ functions, and it'll actually pull your head back over your shoulders easier, which will open up the back of the skull at the occipital bone here, which will open up the space where the jugular foramen is, and the internal jugular vein and the vagus nerve drop down. So you'll actually help your parasympathetic nervous system and the drainage toxin system of the body just by working your tongue. And then people are like, holy crap, that's
Yeah.
amazing. I'm like,
Yep.
yeah, don't neglect your tongue. I mean,
Oh,
it's the strongest muscle in your body, I think, next to your uterus. I think, and since I don't have one of those, it's the most powerful one for me, you
Yeah.
know?
Yeah, yeah, yeah.
So it's up there.
Yeah, it's so key, and, huge, huge things you can find in the mouth. I know for me personally, we're so similar in like our journeys and our stories, because a lot of my dysfunction I found was up here, and now as an adult I'm having to redo all of that because of improperly done things. But my scanning is, I actually, on the instance of brain trauma, I asked them all the way questions back about how their birth was. And adults, like,
Mm.
are very shocked because they're like, "Why are you asking about how I was born?" I said, "Well, that gives me actually how your nervous system started out in the world, and that overlays everything up until the point of where you are." So, that's why I ask questions, were you forceps? Were you whatever it was, how long were you in the birth canal? And then we add in all of those other, subsequent head rattling, head traumas, falls, whatever it was. Um, and then when I start to, look in the mouth, it gives us so many clues. Yes, I'm going over tongue position or tongue restriction or low tongue position. Talking about toxicity with the lymphatic system, if they've got like metals in their mouth or they've got hidden teeth infections, things like that, that's all going to play a role in how their lymphatic system works as well. Um, and then
Yeah, I think
specifically,
the head and the neck are so neglected. Yeah.
yeah, it's for anyone that comes in with, like, foggy brain or even Parkinson's and that stuff, if you look in the mouth, you'll find a bunch of metals in there. Um, and where I was going with that was, once we start, looking at that and figuring that out, I tell people if they're a heavy, massive clencher and they've got, low oxygen, I say, as soon as you start biting or chewing, your nervous system's gonna go back into sympathetic stress. And so it's very difficult for those patients, for myself, even working on the lymphatic system and all of that above, if they've got heavy clenching, if they've got narrowness in their palate, if they're mouth breathers, and that's something I had to fix with myself. Every time you bite or chew, your body goes back into a sympathetic state. And then you got all that back training of the nervous system into that. So that for me is also a really important key to the lymphatic system and the nervous system health, is also assessing how that their stress responses appear. Because if that is always in a imbalance or locked position, or they're not nasal breathing, their palate's narrow, that's a huge reason why they're clenching and grinding, is because their brain needs oxygen and they're just not getting it. So that's typically how I look at those things with
Yeah.
my patients. Yeah,
Oh, that's great. Thank you for sharing that. Yeah, that's a great observation. Yeah, your body always does everything that it can in the moment it's in to protect you and keep you as safe and get what it needs,
yeah,
uh, in
yeah,
any way possible. Yeah. There's no judgment to what it does either. I think that's really important. I don't really look at what the body does as a right, wrong, or I hate the word dysfunctional. I despise that word.
mhm,
Um,
mhm, yeah,
because the body is actually highly functional. It's doing the best it can with what it's got. It doesn't make sense to us, the choice that it made, because we don't know enough about the body to know why it's doing what it's doing.
yeah,
But one of my other favorite quotes that I use all the time, I kind of hijacked a little bit from Neil deGrasse Tyson, if you know who he is, the
mhm.
astrophysicist, astronomer extraordinaire, whatever his title is. I just know he's really smart. He said something on an interview once that just hit me. He said, "The universe is under no obligation to make sense to you." And I'm like, "Holy cow, man. Like, that's brilliant." And then I said, "Well, nothing is actually probably more magical than our own bodies as a universe."
Totally. Yeah,
And so I said, "The human body is under no obligation to make sense to you," which means it's going to keep doing what it's doing in a really
yeah,
smart way that's been time tested in the greatest experiment ever created, which is evolution. And saying to itself, well, maybe one day you'll figure it out. But until then, I'm just going to keep doing what I'm doing. And you're probably going to get it wrong more than you get it right. So you just need to step back. And I take a look at things the way that how I think the body looks at things in and of itself,
yeah,
right? And
and I
that
so
oxygen
appreciate
one is a
that.
big one, like,
Yeah.
huge.
It's huge, and I so appreciate that as we, wrap up our discussion. That's one of the things I appreciate about you most, is your willingness to like talk about all these other levels too. Not only the mechanics of the body, but how the emotions affect the body, how all the chemicals and toxins affect the body. It's just so important. And there's such a taboo, especially on, the emotional part of how to address that and deal with that. And like you work with anything chronic, there's going to be an emotional component there. So that's something I definitely appreciate about you going into that work as well. Thank you so much for your time. I know there's probably like so many other things I would love to talk to you about, but I so appreciate your time today. I honor you for what you've done in our field and what you continue to do and teach us. He's a huge person on education, and you have lots of courses on the lymphatic system. Um, and I hear that you're also releasing a book. Is that right? Or you're working on a
Yes, I am. This book's been in the works for like 4 years, and, it's probably one of the most challenging things I've ever done,
I can tell you that, yes.
that goes into writing. The hardest part about writing is deciding what not to write, 'cause, when I write, I'm kinda like how I talk,
Yeah.
which you'll ask me a question and you'll come back an hour later, and I'm like, "Damn, he's still going. My goodness." It's just it's the same thing with a book, and somebody said to me, "You can write more than one, right?" And I'm like, "Oh, yeah, I could do that." So, yeah,
Oh my
that's a
goodness.
work in progress, and then that'll be called Stop Chasing Pain, of course, to come out. Hopefully, that will be actually manifested into reality, next year if all goes well.
Well, I'm proclaiming
But,
it will,
yeah.
because mine is releasing this year too, and it's been a 3.5 year journey, and I can attest to adding in more and more and more things, and they're just like, "No, you need to stop."
Congratulations. Wonderful.
Thank you.
Awesome.
Yeah,
Yeah.
it'll
Well,
be
do
awesome.
thank you for the kind words. I appreciate that, and I'm gonna circle that right back to you and say ditto on, 1, thank you for having me on the show, and also all the work that you do, and for your kindness of asking me of how I look at things and letting me kinda ramble on a little bit. I had a good it's I can't believe it went that fast. It was fun.
Yeah, I'm sorry, I promised you 45 minutes, and it's already past that.
Oh, no,
That's
that's
how it goes
okay.
when
I
you're in
mean,
the
yeah,
flow.
yeah, that's good. Yeah,
Alright,
no, I'm
very
I'm okay with that time, no worries.
Well, thank you again for joining, and to all of our, followers, we will catch you on the next episode. Have a great day, warriors.